The magic of Disneyland for children is the magic of Mayo for a doctor. To be able to work in a place where you meet people from all around the world, both as colleagues and as patients, to have challenging cases, to have the support staff that do anything to make sure that patients are taken care of. It's really hard to find that all in one package. One of the main reasons that I was so drawn to Mayo is the availability and expertise of people in our other disciplines. These are the people that literally write the textbooks for neurosurgery. And they're humble, approachable Midwesterners that you can literally call on the phone and say, hey, what do you think about this patient? And they want to talk through it with you. The access to world experts also makes it so you can collaborate from a research perspective and do things that are really hard to do elsewhere.
We allow then the residents a lot of autonomy, including the development of their own clinical practice when they're in their PGY 5-year. They have their own service and see patients independently. So we foster that independence as a clinician.
They have this opportunity to work semi-independently. And this is not the case in many other places. They have a block of time where they can function as a consultant. They're the ones who go to tumor board, discuss the cases with the surgeons directly. The surgeons are very comfortable talking to our residents because they understand they're trained well. I really do find that the ownership of the patients, it's much more acceptable and allowable in the Mayo environment. So I find that's a really, really, really strong feature of the program. When our residents graduate, they can hit the ground running. They feel secure, yet they still have the modesty. They've actually realized through their training that their actions have consequences. Overall, it just really develops a very, very, very sound, safe, excellent clinician.
Our residents gain a very complete understanding of the clinical trials process while they're here. We have a very complete and well-organized outcomes database where patients who have undergone treatments have very complete staging, have very complete PRO and toxicity analysis, and that's able to be linked up with their radiation characteristics. We've really built that, what we call the outcomes database infrastructure, very strongly. And for residents, they've been able to mine that for many publications. Tied into that is a very complete biobank that goes along with those patients, which includes both serum, plasma, white blood cells for DNA extraction. It's a resource that patients can really tie in both to radiation outcomes and toxicity outcomes, which again, they can easily assess because we have the outcomes database available. Residents are encouraged to try to open up a prospective clinical trial while they're in training. There are multiple avenues of research available to residents just because of the rich resources we have here, and you're given the time and the resources to do that. At other institutions would spend a good amount of time just trying to find the funding that they can get their projects done with. Most, if not all, resident projects find some way to get funded and in a relatively short time frame as well. So you're not spending the entirety of your research year just writing grants to try to get your research off the ground.
I have a unique perspective in that I actually spent quite a bit of time at Mayo Clinic doing research as a medical student. There's a little bit of a joke within medical students that it can be almost impossible to initiate research, especially at a world-class institution at Mayo Clinic. I wasn't even a medical student here, and so I was quite surprised when multiple faculty responded to my inquiries about starting research projects with them. I think that speaks a lot to how dedicated the people here are.
Mayo Clinic has gotten a prestigious rank through the U.S. News and World Report ranking, but I think what makes the clinic great is that it tries to be both humble and pursue excellence. It doesn't feel elitist here. I think it feels like everyone's working hard, and the prestige comes as a side effect of the pursuit of excellence.
The Mayo Clinic name and then the training that people know that it comes with that Mayo Clinic name has been really invaluable. So there's definitely a pedigree to the name, but also a trust that the physicians that graduate from our program are some of the best trained in the country from the clinical volume, the complexity of cases, the modalities that we have exposure and experience in.
I'm not shy about the fact that I think we have the best training program in the country. That's really because of not only the level of expertise that we have amongst the consultants, but also the modalities and tools that we have to treat patients.
We also provide a lot of mentorship for residents, both in their clinical development, but also in their research development.
I expressed interest in doing an international global health rotation, and it had not existed in our department, but through my interest and the support of Dr. Oliver, our program director, We actually created an international elective that was funded by Mayo Clinic, and I spent a month in Dar es Salaam, Tanzania, doing education and teaching the residents and the faculty at that national hospital how to kind of modernize their radiotherapy techniques, but also got a lot of exposure to third world oncology care.
One of the things that we pride ourselves on, and it certainly has been the tradition since my time with Dr. Oliver after me and now Dr. Corbin, is that the program leadership has always been very responsive to the residents as far as adapting education over time based on generational changes in needs. Over time, preferences have changed and learning styles have changed, and so have we, and will continue to change. I think that's really the most important thing, is that that leadership that hears and listens to the residents and wants to learn how to adapt to best meet the needs of our learners.
Residency is a really unique period of someone's life where we're very enveloped in work and we're very devoted to learning. And I think Rochester offers the perfect balance of convenience in that no one's commute is more than 15 minutes.
Rochester really has the day-to-day shopping and entertainment.
I find the work-life balance to be excellent. I think that we're in a perfect setup where we have an excellent cost of living. We have kind of all of the benefits of living in a city without kind of the congestion and hassle of a daily commute.
Rochester has made it really easy to have a family. You can get all across town pretty quickly. We have really excellent schools, lots of parks. It's an affordable place to live and own or rent. If I were in a bigger city, it might be much harder to start a family as a resident physician. Living here in Rochester has made it really easy and possible.
I couldn't be happier with the pleasant surprise that I found here in Rochester.
Come to Mayo Clinic for the excellent clinical training, for the excellent research training, for the access to world expert faculty. And I think most of us go to medical school and go into training with the idea that we want to be that excellent oncologist. We want to be the person you'd want your mother to see, that you'd want your grandmother to see. I think we can build somebody into that. We can support your interests and needs and really develop the kind of doctor that you would feel comfortable with your family member seeing, that you would fly across the country for them to see.